Hey guys, so we get a lot of questions, and I know there's a lot of information out there and a lot of different things that are popping up. The question is how do I find the right hormone replacement center? What should I look for? How do I look for the right injectable vitamins and amino acids and stuff like that, or where should I go for blood testing? So it's a real easy question to answer. Definitely make sure that you're looking at these things when you're looking for a hormone replacement center, whether it be with Titan or whoever it may be. But make sure that you're going to do blood work every 3 to 6 months. And you might need to do something in between. Just depends on who you are and the physician. But make sure you're looking for that. If they're not making you do blood, but every year or 2 years, that should be a red flag because it's your health. It's ultimately going to come down to your body. So that's a big thing. So make sure you're doing the blood work, okay? You should be doing initial blood work to do it, to start. For vitamins and amino acids, make sure it's the best combination of vitamins and amino acids that you can get. Make sure it's not hurting on the injection side. Compare apples to apples of what's in it, okay? Because that's a big thing. Just because somebody says it's a super B12 shot, well, what does that mean to you, and what else is in there with the B12? You know, so definitely look at those things. Make sure that you're talking to a medical provider. Okay, when you're getting a recommendation about a prescription of medication that's going to go in your body, you should definitely be cautious to who's telling you to put that in your body. So it should be like a nurse practitioner, a physician's assistant, or a medical doctor, and a medical doctor should be your best bet, especially with hormones. Vitamins, amino acids, nurse practitioner, physician's assistant would probably work well, but that's the big thing. Make sure you're looking at blood tests. What blood panels are you getting for the price? Okay, for your blood package, it should be as many tests as possible. The more tests that they show you, the better they're going to have an outlook of what they're doing inside your body when they're giving a recommendation of what is going to optimize your body at that point. So you definitely look for those things.
Well, a couple other things too that you wanted to just throw out there for you guys. First of all, whenever you first start off as like a patient, you really should see somebody. So whether telemedicine, in person, shake a hand, be able to put, you know, a face with a name, so that way you can see who it is that's prescribing you your stuff, and that way you can have a face with a name. So
not
really,
just a phone call.
It's important. It is important. And then also, and this is, I've heard this off of a couple different clinics out there across nationwide. There's this thing that they call patient coordinators or patient care coordinators. Those people, like 99.99999% of them don't have any medical experience. So they're giving you, you know, your recommendations based off of how much money you have to spend with them that day versus your health. So when we put someone, or our clinic puts someone on some sort of therapy, there's a couple different things that go into that, whether it's you're on hormone replacement, especially guys out there, high hemoglobin hematocrit levels. This is why you get checked. You know, say you're retaining water or you're having mood swings or ED issues, you're going to go in and get checked out for that as well. Make sure your liver enzymes aren't going up because you're taking something over the counter that was possibly affecting it, or maybe there's an underlying issue that may be going on and we need to be in correspondence with your other physician. I mean, there's a lot of really important things, and I understand that, you know, a lot of people out there, you want to get quick results, you want to be on the fast track. I get that. But you got to remember that health is number one. And if you are laid up in a hospital bed somewhere, I can promise you that you will not look good. Okay? So you got to make sure health is number one. You got to make sure that the people that you're talking to, they have some sort of experience in this. You know, you can always ask them, like, you know, what's your background? Are you a nurse? Are you a nurse practitioner? Are you a medical assistant? You know, you can ask them, how long have you guys been open for? How long have you been doing this for? You know, who's making the recommendation? That kind of stuff. So that way you can really get to the nitty gritty, and you know what you're putting in your body, and you know the recommendations that's being made to you is because of your health and not so much for your pocket. So, I mean, it's important. It's very important.
When you get your blood results, make sure you understand what you're getting on your blood results. Not the doctor says, everything's great. Well, great. Can I have a copy so I can obtain it from my records? I make sure I track my progress and my blood work. If I need to go to a specialist down the road. The big thing with monitoring is that, like she said, hemoglobin, hematocrit, red blood cell count could be through the roof. And this is on 200 milligrams of testosterone per week, possibly for patients. That's a normal HRT dose, or 100 milligrams. Some people it's different. So at that point, if they're not monitoring you, but every year, and your blood gets that thick, it can cause a stroke. I mean, you can get blood
Pulmonary
clots.
embolism,
I mean,
blood clot,
and
heart attack. You know all those negative things you see on the lawyer HRT lawsuit commercials?
Yeah.
You can prevent those things if you're being monitored.
Yeah.
So it's really important that you are being monitored. Also, guys, once you hit, let's call it 40, out there, your PSA, really important. Make sure that your PSAs are within normal limits and they're not going up, guys, because I'm telling you, if you catch some of these things early and, you know, you don't just blindside it or dismiss it, you know, you can actually, you know, be a savior of your own health.
Yep. Prostate, that's what PSA means. So it means your prostate, and prostate cancer is on the rise for males. So you definitely want to be monitored. Make sure whoever's doing your hormone replacement therapy is monitoring you. They're educating you on why you're taking some of these therapies, how it's going to benefit you, possible negative side effects. You always want to look at all these different things and make sure that that is the medical center or medical provider that you want to be with, because health should be your number one priority for them and you. Because if you're not here, you're not going to be a patient, you're not going to be doing the favorite things you're doing outside for activities. So make sure that you are aware of who you're dealing with, whether it be in person or whether it be online or wherever you're going to mess with at that point. It's always good to, you know, throw caution to the wind.
Yeah, just dropping a little knowledge for you guys, because we do care about our patients. Those of you that are Titan patients out there, all of you guys know that we do care about you guys, and we check up on you guys frequently. Make sure things are going well. Make sure you're not having side effects. Make sure that you're being taken care of. Make sure that we're in correspondence with any other physicians that you might need us to be in correspondence with. Our medical provider, contact your medical provider. We make sure that your health is number one. So it's important not only to our clinic, to me and John, to everybody here, all our staff members, we all are the same exact way. We all feel very strongly about it, hence the video.
So guys, if you want more information about Titan Medical Center, go to YouTube, check out all our videos. We've got instruction videos on how to inject, injections, therapies, all the works. Or check us out on social media, Facebook, Twitter, Instagram. We have all great information and content for you there too as well. So this is John and Sharice signing off from Titan.